done me put some more book between the more rims a tringa my brother was in some whoop came my chassis whoop check womp so but yes I'm a chassis and to me yeah my chadia make us free your body who do me a fake when I'm heaty who do me a fake when I'm hitty who sum me why now pimping wedgie who come to media
Okay, so it's yet another lovely Tuesday morning right here on Fila FM 89.3. It is a brand new month, the month of July. It's the very first day of July 2025. And today it has been dedicated as Ghanaians to thank God and to seek his face. And you know, baby, I shibiano. Now the ultimate sorry on your own. Pray for the country Ghana. Now, on my no echo year, a beboy na meboa. I man ye beboy so even in your closets, today is not a holiday. Today is supposed to be a holiday, but it has been shifted to Friday. So whether you are at your workplace, wherever you are, just say a prayer for the country Ghana. So many thanks to you for joining us. This is your Real Talk Radio, and we're coming your way with our mental health show. We come your way every Tuesday morning. Thank God today is not a holiday, and a holiday but thankfully it's not a holiday, so we are here to bring you our mental health show. So join us live on Facebook, Fila FM 89.3. Fila FM 89.3. And as you join us, please remember to also share the link for others to also join us on Facebook. Share the link and others will also join and benefit from our discussion. So today we're going to be looking at illness, anxiety, disorder. Illness, anxiety, disorder. Barnabas Atangondo is here. Shaida Brima is here, and then Emanuela is also here. Thanks to Kumsin Matthew, we are live on Facebook. My name is Akusia Kwatimabwachi. So quickly, let me welcome my ladies and then gentlemen. Good morning, ladies and gentlemen.
Good morning, AKB.
Good morning.
I hope you are doing well.
Yes.
Okay, we thank God. Illness, anxiety, disorder. Barnabas.
Okay.
So when we say illness, anxiety, disorder, talk to me. What is it about?
Okay. Good morning to our cherished listeners, and we thank God that we are having another blessed day to talk about mental health. And as you rightly said, 1st July, that's the Republic Day. So as we are all trying to pray to God about helping the country, we are also here to talk about how we can consider certain mental illness, and when we are being affected by it, or our relatives or loved ones have been affected by it, we can also help them seek help. So when we talk about illness, anxiety, disorder, what we have to know is that it's also a mental condition. And with this mental condition, it was previously known as hypochondriasis or hypochondria, but now we refer to it as illness, anxiety, disorder. So in case you hear hypochondria or hypochondriasis, it means the same thing. So with illness, anxiety, disorder, as I rightly said, that is a mental condition. This condition is related to people having persistent fear. Remember, the name has anxiety in it. So any disorder that you experience, or we talk about that you hear anxiety to be related to it, is either the person is having a lot of worries, or the person is having a lot of fear associated to something. So with this particular mental condition, you realize that the individual that experience it has a lot of worries and a lot of fears associated to certain symptoms that they perceive to be experiencing. And with illness, anxiety, disorder, the critical thing is that sometimes these people that are complaining of these symptoms, the symptoms might be very negligible. So if I say negligible, the symptoms might be very small or very few, that it is not enough to have been said to have caused a particular condition or to cause a particular illness. But these people have persistent fear that the condition that the symptoms that they are experiencing is because of another serious condition that is happening. And in certain instances, you even realize that there are no symptoms at all, but this individual will still be complaining that he or she has a particular physical condition. So a typical example is that someone can tell you that, oh, as I'm sitting down, I feel like my blood pressure is very high, and because my blood pressure is very high, I believe I'm having a heart condition as it stands now. And you might send this person to the hospital, go and do all the necessary check the person's BP, that's blood pressure. You realize that the person's blood pressure might not be high, or even if it is high, it is just a little high. And you go and do all related cardiovascular tests, and you realize that every test is normal, but this person is still insisting that they believe that they have a heart condition. And with this, it is not like the person is intentionally doing this or framing this or developing this. They do it without their intention. They do it without their knowledge that that is the condition that they are experiencing. So with illness anxiety disorder, people become very preoccupied with the fear and with their worries that they are having a particular physical illness, where the evidence that we gather also says the opposite. So the evidence that we gather medically does not support that the person has a particular physical condition. So someone can say that I went to urinate, and the way my urine was, for me, it looks more yellowish than it should be. So because of that, maybe I'm having a kidney condition. You send that person to the hospital, go and run RFT, which is the functioning of the kidney, and you realize that every value or every parameter is normal. But this person will still insist that, no, because I saw my urine to be this way, I think that I'm having a kidney condition. Sometimes, if you are able to disprove the person that, oh, now you don't have a kidney condition, by the time you realize, the person will tell you, oh, but if I don't even have a kidney condition, the last time I experienced a particular pain at one side of my rib, and because of that, I am having a liver condition. So sometimes you're able to disprove them of having a particular physical condition, and quickly they will develop another. Yes, they will change to another thing, and it continues like that consistently. And imagine someone feeling that they are having a particular serious condition, and sometimes these people, because they believe that they are having a serious condition, they believe that they are going to die very soon. And if you are someone that is thinking or having that perception that you are having this particular condition, and because of that you are going to die, you realize that your life is going to be miserable. If you are married, if you are in a relationship, you are not going to be able to have the peace of mind to concentrate on that particular relationship or that particular marriage. So we realize that people that experience this, it is going to have a great toll on their relationship. It's going to have a great toll on their career life. So you experience people not even able to sit at one place to go to work. And when I talk, anytime that I talk about this particular condition, back in school learning about it, I thought it was just something real that I would never see before. But coming to Tamale, I've witnessed some, and it was terrible. It was actually serious, and it's not that easy to just handle it. And when we look at illness anxiety disorder, what we know is that within the population or within the community, as we say, it has been estimated that about 1.3 to 10% of people within us has illness anxiety disorder. So it means that between 1%, so let's say if we take about 100 people, maybe one of them have it, and it can be from 1 to 10. So if you take 100 people, 10 people can have this condition that we are talking about. With people who are even within the health service and people who are normally engaged in trauma care, or people who are engaged in emergency care, their percentage is also somehow that higher. So when we look at illness anxiety disorder, this is something that people are actually experiencing. And when we talk about the types, you get to know how they vary and why sometimes people even experience it, and we the health professionals don't even get to know that people are experiencing this. But before I end on this, maybe subsequently we are going to talk about another condition called somatic symptom disorder. But I just want to throw it out there that it shares some similarities with illness anxiety disorder. Sometimes we have people coming to the hospital, and for them, genuinely they have some physical symptoms that you can verify that there are some physical symptoms. And with those people, they also have worries about their health. But with illness anxiety disorder, the symptoms may not even be there, or it might even be small, and they are complaining about it. So for the somatic symptom disorder, the symptom might be there, but it will not be the symptom that is causing any physical condition or any mental condition. But these people might complain about the symptom. And with illness anxiety disorder, the symptom might not be there at all. And these people will still be preoccupied that they are having a serious medical condition, or they are having a serious illness that if they don't take care of it, it may cause them to die. So subsequent or later on, we will talk more into the symptom, somatic symptom disorder. Just that because they share some similarities, I just wanted to throw it out there. So the main important thing is that we have to know that there is a mental condition out there that when it happens to people, people begin to believe that they are having a particular physical condition. And with these people, it is easier for them to just see you on their way and begin to explain themselves to you. That you realize that now I've become this way is because I'm having this particular condition. And the unfortunate thing is that they will be the same people spreading their own issue. And when they finish, they now begin to feel that people are talking about them, and because of that, they cannot really stay in the community. So when we are having people, or we have people within our community where we realize that every time they are complaining that they might be having a particular physical condition, that condition might kill them, but you realize that the symptoms that they are complaining about is too outrageous to have caused that particular condition. Let's try our best to actually direct them to the appropriate place to seek help, because it might be illness anxiety disorder that they may be battling out there.
Okay. Thanks very much, Barnabas. So you already mentioned that when we get to the types, we will understand certain things. So I want to now go to Emanuela Ella to take us through the types of illness anxiety disorder.
Okay. So with illness anxiety disorder, we have two main types. The first one is the care seeking type, and then the next one is the care avoidance type. So I'll talk about the care seeking type first.
Okay.
So individuals with this care seeking type, they frequently visit the hospital, or they frequently seek for medical treatment. There's nothing wrong with the person, or maybe the person has a slight symptom, say a headache. Then this person will assume immediately that this headache, it means I have a brain tumor. Majority of the time, we like to Google our symptoms. So maybe 3 years ago you had a pain in your arm, then next year you have this. So the person can Google all the symptoms at once, and then Google will give you something outrageous, and you put it in your mind, this is wrong with me. Then the person will visit medical professionals, run every test possible. Then you see that there's nothing wrong with this person. The test is showing that everything is fine, but this person believes that something is wrong with me. Like Barnabas said, you'll be able to disprove the facts. The person feels like something is wrong with me. You run tests to show that, everything is fine, nothing is wrong with you. Maybe you are just exaggerating something. But then this person will get okay, the person will go and sleep. Then the next day you wake up, something else is wrong. Then this person will put another thing in the head, this is wrong with me. The person keeps going to the hospital, keeps going for tests, because he or she believes that there's something wrong with the person. Then the second type is the care avoidant type. Here, people may experience something. Maybe a person is stressed over something, or something might be wrong with the person. But this person believes that if I go to the hospital, let me use the headache example again. The person has had headache. So the person will believe that if I go to the hospital and they run tests, these people are going to say I have a brain tumor. These people are going to say I have cancer, I'm going to die. So as a result, this person avoids seeking help from the medical professionals. The person might be seriously going through something, even though it's not what the person thinks it will be. But then because he or she is scared that when I go to the hospital, the doctors are going to say this is wrong with me, the person avoids going to seek medical care. So the two differences are one person seeks care all the time, even by the slightest thing, because the person feels like something is wrong with me, and then the care avoidant type, the person avoids seeking for care because they believe that they will find something that is wrong with them, and they don't want to know that that thing is wrong with them.
Okay, so Shada, what are the causes or risk factors of illness anxiety disorder?
Okay, as we always say, we don't really know the exact cause, but there are a few risk factors. Um, so one of the risk factors are health issues or other anxiety disorders in the family. So when you are in a family where maybe a parent or relative has a health anxiety or any anxiety disorder, you are at a higher possibility, or you have a higher chance of developing illness anxiety disorder, because it can be transferred through hereditary or like genes. And then childhood illness or serious illness in your family during childhood. So if you experience a serious childhood illness, there's a possibility that you might develop illness anxiety disorder. Because maybe growing up, if you experience any small symptom, you might feel like, hey, maybe my illness is coming back, because this is what was happening to me before my illness came. So if care is not taken, I'm going to probably experience that condition again, and I wouldn't like that. So you're going to be very anxious when you're even taken to a hospital, and then a doctor reassures you that, oh, everything is fine with you. You're still going to be very, anxious. So it's a likelihood, or it increases your chances of developing illness anxiety disorder if you've experienced childhood illness. And then mental health issues such as anxiety or depression. So if you are someone that is experiencing depression or anxiety in the sense that little things makes you very worried, to the extent that if nothing is done about it, you find it very hard to relax. It increases your chances. So someone with anxiety disorder, if you realize that you're even experiencing, let's say, as Ella mentioned, headaches, you've realized that you have headaches for like maybe 2 or 3 days and it's not going, you start to get very worried. Why are my headaches not going? I've visited the doctor, I've taken medication, but it keeps coming back. So your anxiety is going to keep rising, because you feel like the headache is just a symptom of a bigger illness that hasn't been identified yet. So yeah, you're at risk of developing illness anxiety disorder. And also I spoke about depression. Someone that is already depressed, that is experiencing extreme sadness, are very, I don't know, touchy. So meaning the rape that I was raped, like maybe I've developed HIV from that, like, so symptoms that are not even related to that. I realize that you keep searching, because you are so worried. Yeah, so that can also increase your chances of developing illness anxiety disorder. And extreme stress, sometimes too, when someone is stressed too much, it takes a toll on us, it takes a toll on our health. Let's say maybe you are in a very stressful workplace, and then you've tried to complain to your boss severally that, please, like, if something could be done about maybe your working hours, and then the boss says no, then you start thinking a lot. So when you go home and then you're even experiencing like small backache, or your knee starts hurting or starts failing you, then you now start blaming your boss. You asked him to work on your work hours, and then he's not doing anything. Now see, you're about to probably be amputated because your legs are hurting, and a whole lot. So like stress can sometimes mess up your thinking and all that. So yeah, it's extreme stress is also like a risk factor to developing illness anxiety disorder. So these are just a few that I'll mention.
Okay, thank you for mentioning a few as I come back to Barnabas, so that Barnabas will take us through the symptoms or signs of illness anxiety disorder.
So, AKB, there are a couple of signs and symptoms that we can talk about when it comes to illness anxiety disorder.
Okay.
And these are some of the critical or important things that individuals should know. So the first important thing that I will talk about is that we have to know that with the signs and symptoms, or with the complaints of having a particular condition, it has to be unrealistic. So yes, we all experience certain things. So for instance, our heart beats, we have normal heart rate. You can sometimes feel your pulse on your own body and all those kind of things. But these people, these normal things that normally happens to us, sometimes you can have a small itch on your body and you have to just irritation on your body and you have to just wipe it out with your hand or something. So these normal bodily functions that normally goes on around us, with these people that we are going to talk about, they actually exaggerate, and the way they talk about it becomes very unrealistic. So the first thing that we have to know is that if the person is so complaining to the extent that you are just there and you realize that abba, the way you are complaining about this condition, it cannot actually be the case. That should be the first sign for you to know that this person might be going through something else, that it is not really related to the physical condition that they are talking about. The next thing is that you are going to see these people avoiding places that they think if they go there they can catch an illness. So just as Ella talked about some of the types, one being care seeking and one being avoidance behavior, these people are going to avoid places where they think they can catch illness. So if for them they feel that a particular maybe chickens or fowls have some infection that can easily that they can easily be infected with, they will try to shy away from getting closer to chicken. They are not going to eat it. They are not going to go closer to it. Any person that is selling food that has chicken and being serving them, they are not going to go closer to it. So realize that they will be trying to avoid certain places because they feel that, or they believe that if they go to those places, they are going to catch a particular illness.
Okay.
The next thing is that you can also see them also constantly researching symptoms of disease and the disease themselves. So if the person is educated and can use Android phone, they can stay on their phone for a very long time. And as Shahada earlier on talked about, doing those searches, they can ascribe to themselves, or they can associate themselves to hundreds of conditions. The truth is that AKB, if we all pick phone and we search for what condition can headache cause, headache can be triggered by a lot
So
of
many
conditions.
things, yeah.
So imagine you just type that. You are going to get a lot of conditions. Some are going to be severe, some are going to be serious, and other things. So you are going to realize that this person is going to be associating themselves to all these conditions that he or she saw on the net. And this becomes something constant that they keep on doing. So anytime that they feel a particular sensation on their body, they feel the need to go and search. And once they search it, they now begin to believe that, oh, because I searched and I saw it, it means that I have this condition, which is not actually the case.
Yeah.
Then the next symptom is that they also have high levels of anxiety about their personal health. So they, as we talked about already, they can exaggerate it and say because of that they are going to die. So a simple thing is that someone can just cough, normal cough. Sometimes even if you sneeze pepper powder, you cough.
Yeah.
But these people may not interpret it that, oh, maybe it's because I smell dust, or I smell a particular substance that is not good for my body. My body is trying to push it out. They will interpret it to be, oh, because I cough, I think I have lung cancer. That is how their thinking actually follows. So you realize that they are going to have high levels of anxiety about themselves. So any small thing, they are associating it to a particular bigger condition or higher condition. In also doing that, they become very obsessed about their normal bodily functions. So you realize that this person can now begin to be checking the way their heart is beating. They can meet you and say, hey, the way my heart is beating, looks like it's beating too much. Oh. I counted the numbers and it looks like the numbers, they are not tallying. Or the person will tell you, hey, I say, maybe go slow. Now we sure say makuma na nye bibia. So they become very conscious about some of these bodily symptoms. But on a normal day, our heart is still beating, but we don't really focus on it like that. But these people become very attentive and very focused about it. And sometimes they even become very conscious about even normal body temperature. we train you now in Sako Fana Moto because no,
I will not sack of what we are put to mind.
Or no, motor you or because the way the temperature there is no, it feels like there might be something wrong, there might be something ongoing. Their skin might be having some mutations, or they might be having some skin cancer that is causing some of these things. So they become very conscious about normal bodily functions that they experience. And you realize that these individuals, especially if they are the care-seeking type, will begin to now be checking or visiting the hospital very often. That is when you begin to see the person doing hospital shopping. Just as we have window shopping, there's also hospital shopping.
Also hospital shopping.
Yes. So you can open someone's bag and the kind of test, the kind of cars that they have. If it's this northern region, there will be no hospital or health center that they will not go to. They will go everywhere, and when they go, all their tests and everything is in their folders. So when they come, they will just display it to you. Look, when I went here, that's what they said.
Okay, tell the pink sheet no the name.
Well, prove evidence number. Where there, you and I were there. We were not there. We there or no other at all. So he will give you everything for you to go through and see. So realize that they have a lot of documents from different hospitals. And the sad thing is that within all these different hospitals, you are not going to see any evidence that maybe they have a liver condition, they have a kidney condition, they have the cancer that they are worried about. But these people will still be persisting that, oh, because my body has been behaving a particular way, I think I have the cancer, or I have a serious medical condition that I need to take care of. And one important thing is that, and this is where it becomes frustrating to family members as well, they always, when they are telling you some of these things, they want to seek reassurance from you. And imagine, how long can you keep on seeking reassurance and also providing assuring them every day, every now and then? It will get to a time you get fed up. And when people get fed up, that's when they also now begin to feel that my people have now rejected me. The people are tired. And the one that I experienced, I remember how the person was talking about how the family member doesn't believe her again and other things. And when she begins to tell us her story, you realize that the family members supported her to go through a lot of hospitals, because at the beginning they believed whatever that she was saying was actually what was happening, even to the extent of going to herbalists, spiritualists, just to make sure that the person was well. But consistently they realized that the thing was still persisting. What they were trying to seek help for was not resolving. And these people cannot keep on. Sometimes we are also individuals. People get frustrated and they get tired. So they also became frustrated and got tired, and it looks like they've left her issue for her. And she also began to feel that the people have now rejected her. So these individuals realize that even though they are complaining about illness and other things, they do it to also kind of seek some reassurance from you. And if you realize that this is an individual that's constantly telling you so that you reassure them, continuously to reassure them. And the one thing is that you are the person that continues to reassure them, or better also, because of other go for no mano into a baba and you miracle or befro, or what da or befro, or befro, bibi kakrabina or befro, so change the matro, just for you to provide them that reassurance. And earlier on I mentioned that one important thing is that one so spread amongst them.
Okay.
Because of that sense of seeking reassurance, Oshia will be our minds are like Robert Machero. Say Adia will communi. Now said the person will be able to sympathize with them, or to be able to reassure them in whatever that they are going through. So AKB, these are some of the symptoms that we have to take note of. But the important thing is that we should know that all these signs and symptoms that I talked about, we will realize that the complaints or the lamentations of the individual becomes very unreal, because sometimes if we know that the person has a physical condition, it comes with some matching symptoms that the person described. But you realize that this is becoming too overboard. Today this, today that, today this, today that. Then you should realize that this person is going through illness, anxiety disorder, that possibly you should let a person seek for mental health services.
Okay, thank you very, very much, Barnabas, for taking us through the symptoms or signs of illness anxiety disorder. So, coming back to Emanuela, let's look at the complications of this illness anxiety disorder.
Okay, so illness anxiety disorder, some of the complications would be it could lead to the development of other mental health conditions. For example, Barnabas mentioned somatic symptom disorder, and it could also lead to anxiety and depression. I would explain. So, with its leading to somatic symptom disorder, for instance, someone with illness anxiety disorder, this person would go and then the person feels like I have a headache, and you go and Google, okay, headache can lead to say brain cancer. Then the next thing the person goes to see is what are the symptoms of brain cancer. Then as you are reading them, certain times our mind starts to imagine the symptoms and then we start to feel them. When I was in school and I started learning about some of the mental health conditions, every time after class I feel like I have that condition. Because like I've imagined the symptoms on myself until after a while. So yeah, this person would imagine that okay, I have headache. It means this could also be happening to me. Then all of a sudden, the person starts to experience those symptoms. It could also lead to the other mental health condition I mentioned were depression and anxiety. So with depression and anxiety, with the anxiety, it leads to constant worry. You are always worried about if something is wrong with me, something is going to happen to me. You become worried about the slightest thing. And then also depression. Yeah, like when I even go to the hospital, these doctors don't take me serious. You become sad about it. You're always sad, you're always worried, you're always thinking about what could be wrong with you. As a result, you could develop other mental health conditions. Another complication would be unnecessary medical tests and potential test complications. With this person has gone to the hospital. Even when the doctors say there's nothing wrong with the person, because say this person has googled their symptoms before coming to the hospital, he starts to request for various tests. Okay, x-ray, do an x-ray here, run MRI, do this, do that. As a result, you've literally exhausted all the tests the hospital they run in that hospital, and these things they come with finances. Most of the tests in the hospitals are not free, so you constantly spend money on unnecessary tests. And then we know most of these tests, especially the x-ray, deals with radiation, and if you are consistently under an x-ray machine everywhere you go, x-ray, you might have certain complications or maybe radiation poisoning as a result of the constant tests you've been running. It could also lead to problems in relationships. For instance, the example Barnabas gave, this is a person where in the beginning your family was constantly in support, and then they were there for you and helping you. But then they've realized that every single day something new is wrong with you. Even when you go to hospital A and hospital A says that oh, nothing is wrong with you, the next day you complain that hey, something new has happened. Your family will get frustrated. It would strain your. Might even start to avoid your calls and avoid your presence because they know that you there when you call is because something is wrong with you. And when it even becomes serious and then there's actually something wrong with you, you might not have anybody to be there for you. And okay, illness anxiety disorder could also impair your performance at work, because if you are here, you are feeling like you are always sick. This is somebody you constantly be taking leaves, or even you'll be present at the office but you're not working because you feel like I am sick. If I'm sick, I shouldn't work. Or you constantly absent yourself from the workplace because you're running around doing tests and then other things. It could also impair daily life. It could also impair your quality of life, because if you are there and you are always worried about something, there's no way you are going to enjoy your life because you feel like you are sick. I'm sick. Doctors are not listening to me. So some stuff like that, you will not be comfortable. You will generally not be happy in this life because you are always running from one place to another. So the few things I have mentioned are some of the complications of illness anxiety disorder.
Okay, many thanks to you. And I'll be coming back to Shada so that Shada can tell us how this illness anxiety disorder can be managed. In all things, of course, we need to manage it anyways. So how can this anxiety disorder be managed?
Okay, so first of all, it can be managed using cognitive behavioral therapy. So here, your psychologist or health professional will help you through your fears and anxieties, and then help you with better ways or better coping mechanisms of, yes, of handling the anxiety. So they help you go through your fears, what it is you are worried about and all that, and then they just try to help you instead of constantly going to the hospital, or instead of engaging in those negative behaviors, they help replace those behaviors with positive ones, so that it will reduce your anxiety. It's not just going to go the moment you start, it's going to take time. So maybe instead of thinking so much about your symptoms that might not really be serious, they might help you think of other things. Maybe um, do something you love, spend time with a loved one, go out, like do something to just distract you. So they just help you with better ways of coping with the symptoms. They'll not just tell you that what you're experiencing is false. They'll just walk through the thing with you, and then help you live with it or cope with it in a better way. And then medications, sometimes medications are given for the anxiety or depression. So they can give you antidepressants or serotonin reuptake inhibitors, so that it will reduce the anxiety that you experience daily, and also the depression that you sometimes experience as a result of this disorder. And it can also be taught relaxation techniques like deep breathing. Sometimes in situations where you're angry or you're scared or you're anxious, you're advised to like just take your time and then breathe in and breathe out. Sometimes it really helps to relax. So you'll be taught some techniques like that. Meditation too. You'll be taught on how to use these techniques when you realize that your anxiety is coming. But when you realize that you're getting too scared about something, constantly thinking about something that you think is bothering you. So they help you with these techniques, yeah, so that you'll be able to relax whenever these kind of thoughts like invade
Mind.
your mind, yeah. And then education and support. Sometimes you are educated about the condition, and then you get the necessary support that you need, maybe from loved ones, from your colleagues, from your employers, or even your employees, if in this case you are the employer. And then exposure and response prevention. So sometimes they put you, like they expose you to the symptoms, like they, maybe you say you constantly experience headache, they might let you experience that headache, like at that moment you're experiencing it. So they now teach you response prevention.
How would they make you experience the symptom?
um Maybe in not like they are going to induce the headache, but you see sometimes when they tell you, some might just tell you that, oh, forget about this headache, it might even go or something. But this one, they allow you live through it. They don't ask you to like just push out the headache. Like they actually encourage you to like like feel it, allow the headache to come. I don't know how to explain this.
And just to add on, there's a technique that we call imagery.
Okay.
So with imagery, what psychologists normally seek to do is that they tell you to imagine that you are in a particular situation.
Okay.
And once you are in that situation, it triggers certain feelings in you. So what she's talking about, the exposure, that is what we basically do. So
Okay.
it's a form of imagination therapy.
So
once,
imagine that you are having headache.
yes. So if you imagine those things, it stimulates some kind of sensations in you. It just as, for instance, someone losing the loved one, and years on, something happens and the person is able to still feel sad about it.
Yeah.
It is because the mind triggers or imagines that the thing is happening again.
Okay.
That is why you're able to experience it that way. So that is the technique that we use, or when we talk about the exposure, that is how we do it. So when we imagine that we are in a particular situation, it triggers certain feelings in you. So it just as, for instance, someone losing the loved one, and years on, something happens and the person is able to still feel sad about it. It is because the mind triggers or imagines that the thing is happening again. That is why you're able to experience it that way. So that is the technique that we use, or when we talk about the exposure, that is how we do it. for you the person to re-experience the feelings, to experience the pain, kind of, so that we help the person, we teach the person certain skills to be able to manage the conditions or the pain when they come second.
Okay.
Yeah, so that's basically it.
That's it. Oh, okay. All right. So thank you very, very much. So this morning we've been looking at illness, anxiety, disorder. You think the thing is there, but it is not there. It's just a figment of your imagination. Do all manner of tests and it is negative, but still you feel that thing is there. So if it has been happening to you, then it's illness, anxiety, disorder, and you need to seek help. Abi.
Yeah.
Nti kɔ nneɛma o. Ɛkɔ Barnabas mu ɛwɔ hɔ. Ya no ɔmo nyɛ adwuma nyɛ na ɔmo mmoa o. Ɛna ɛfiri hɔ. Okay, thanks so much for joining me this morning. Let me pick your final words and then we are out of here. Shada. Okay, so Ella, you start.
I'd like to say a good morning to all our viewers and listeners, and thank you to Fela FM for giving us the opportunity to be here this morning.
Okay, thanks to you as well. So let me quickly come to Shada for her to also, as a Shada, as a me wanna show. As a Shada and also Shada, let's pick your final words.
So I'll just say good morning to our viewers and listeners. Stay safe wherever you are.
And you stay safe too. Barnabas. The woman Becca said, "Qual vi." Qual vi.
So what I would say is that sometimes we commonly hear that be so wakos but me ko ye test ni nyina doctor ne se bibia ha me and so still na me honam no saa na esitie. There are mental health professionals there. Ebi ana enema bi a ahye wo so ena e ma wo hu se bi a how bi wo. Nti ye wo san kofo no ho a omo nso di saa adwuma no. Nti wakọ hospital akọ ebi a wo hu se enema bi ha so still doctor for so mu hu hwe a ye wo other special nkofo ho a omo nso adwuma eye no. So we just want to encourage everyone that if you know someone that have been going through some of these symptoms that we talked about, it is the right time for you to refer the person to the appropriate place to seek help. And as I always say, for now, Northern region, we are blessed. We are having a lot of psychiatrists, a lot of psychologists around now that are always ready to take care of us, and also mental health nurses. My mom in community mental health officers, they are also around to make sure that they take care of you wherever that you are. So in case you are experiencing any condition that you have actually thought about it and you don't really get it, you can always fall upon these mental health professionals. And even if you come and you talk to them, they will have time to talk to you. And if you come and you talk to them and they realize that with your particular condition, we can help you in this way, they will direct you to the appropriate place to seek help. So I want to end by also saying thank you to Fela FM for always giving us the opportunity, and also thank you to the people that have been supporting us, a lot of our silent listeners that have been supporting us around. You are the source of the reason why we keep on doing some of these things that we do. You always motivate us, you encourage us to be able to come here to do whatever that we do. And I cannot end by saying good morning and a good morning to my in charge, Mama Yvonne, back at West Hospital. And we also thank her for the support that she has been giving us always to be here to educate people about mental health and Mother Ghana, to improve the well-being of Ghanaians in general. So AKB, we thank you very much for the opportunity.
Many thanks to you as well, Barnabas, Atangongo, Shada, Asuma, and also Emanuela Tembil for joining us this morning to educate us on our illness, anxiety disorder. To all our listeners, to all our viewers on Facebook, we say many thanks to you as well for joining. Join us same time next week as we bring you another important topic and then discuss on the mental health show. So we are done. Thanks to Kumsin Matthew. My name is Akusia Kwatima Boache. By kind courtesy, DBS Industries rejoining the nation's capital for the discussion segment. Do stay tuned in. We'll be right back. Bye.
deɛ mɛkyerɛ ne sɛ ɛdeɛ nkora ne mpaebɔ a yɛsi yɛkɔbɔ mpaebɔ ɛdeɛ ne aseda yɛakyerɛ yɛn sɛ mpaebɔ yɛ kwan a yɛfa so ne nyame edi nkita